First of all, I want to welcome the Minister to the House. And I have to say, when I hear politicians say that we should put politics aside, it's always politicians in government. The reality is that when the Minister for Health was in opposition, he was a very robust opposition spokesperson for health, and rightly so. Our job is to hold the government to account. And yes, we will work constructively with the government if the government are making the right decisions. But in lots of areas, we don't see the government making the right decisions. A number of people, Minister, a number of previous senators have made mention of the Titanic. This year is the centenary of the sinking of the Titanic. And I think it is apt for those senators to raise that analogy in terms of where the health services are at today and where this bill is at. We give support to this bill only because it is an improvement, not because we believe it will actually fundamentally deal with the real problems in the health service. And we do believe this is essentially rearranging the deck chairs on the Titanic. Minister, our public health services are struggling from day to day. People who work in the health service are under very real crisis. Our hospitals are suffering up and down the country, and I'm sure you're aware of that. Many of our hospitals are reeling from the latest round of cuts of €130 million, cuts to home care packages, cuts to home help. And we also, of course, had the €750 million which was taken out of the health budget in 2012, and of course €1 billion which was taken in 2011. And I also want to put on the record that Fianna Fáil were also responsible for taking huge amounts of money out of the health service and for not properly reforming the health service as well. And they too have to take responsibility for that. We also have the recruitment ban. We have restrictions on overtime, and we have the hiring of agency staff. All of this is having a very real impact on our health services. Minister, Senator Crown made mention of the deal that was done with consultants, and that may be a good deal, and we'll have to see how all of that works out. But if we have less staff, if we have less nurses, if we have less doctors, if we have less capacity in our surgical theatres up and down this country, then that deal is not going to amount to all that much. I come from the South East, and in our regional hospital in the South East, this year, because of cutbacks that you and your party and your government and you as Minister for Health put in place, meant that we lost 3 surgical theatres, we went from 8 to 5, we lost 25 inpatient beds, we lost 6 paediatric beds, we lost frontline staff, and that is having an impact on patient care. And you will have seen, Minister, the reports of increased waiting times for outpatient activity, for orthopaedic waiting times in Waterford Regional Hospital. You can shake your head, that is the reality. The clinical director of Waterford Regional Hospital was on local radio this week confirming that that is the case. So that's the reality. So in some areas, waiting times are up. It's also true to say, Minister, that really what we're trying to bring about here is accountability in our health services. Pontius Pilate himself could not have come up with a better system than the one that's there at the moment. Because the big problem we've had in the health service for far too long is nobody takes responsibility. And that goes back to previous governments as well. There has to be responsibility. So how are we in a new era of responsibility, Minister, when cuts of €130 million are announced, and yet you did not make those announcements? It was a senior civil servant to make those announcements. How is the buck stopping with you? How is that taking responsibility for what's happening in the health service? It is not. So the buck has to stop with you, and if we are to have real accountability, then you have to take control. You made a big deal of saying that I am going to take the reins of the HSE, I am going to take control. But when the announcement had to be made of €130 million of cuts, you were nowhere to be seen, and that is the reality. And you were forced into a humiliating climb down on the cuts to personal assistance to people with disabilities, only because those unfortunate people had to camp outside this house, outside government buildings, to get you to do what was right, and that is the reality. We also had Cathal McGee, who we know resigned because of problems that were in the health service and a lack of movement as well. There's no doubt, Minister, that what's in this bill will be a slight improvement. But it is still creating a layer of bureaucracy. It is still about management. And Senator Crown is right. What I want to see is a model of a genuine health partnership. Because what about the voices of patient groups? What about the voices of advocate groups? What about democratising the health service? That's something that you and your party spoke about when you were in opposition, being very critical of the previous government who abolished the health boards. What about local democracy and local accountability? Why is it always bureaucrats and technocrats who are the people who are responsible for what's happening in the health service? What about people who represent real people? People who represent people with disabilities? People who represent older people? Local politicians who represent people who are elected? Surely they too should be part of how the health service is run. Your white paper on universal health insurance, Minister, is not going to be delivered as promised. That's going to be held up. We still don't know how that's going to be rolled out. I've heard a lot about the Boston model, the Berlin model, whether it'll be the Dutch or the Deutsch model. What I want is a model which is based on equality. That's what we need. One where patients are treated on the basis of need and need alone, and not on the basis of ability to pay. And that should be a system which is free at the point of delivery and funded through general taxation. That's what I want to see. That's the model that we should see. You've also shelved the free GP care to long-term illness patients. That's been put on the back burner. And I also want to raise as well the very important issue which is raised by mental health reform regarding this bill. While they welcome the government's intention to improve the accountability of the HSE through the bill, mental health reform states that the current draft does not ensure that a director for mental health who has the competence to drive implementation of the government's mental health policy will be appointed. That's a very important point that needs to be taken on board as well. And finally, Minister, can I draw your attention to a very important issue which is facing patients and the people of the South East? Because I listened to the clinical director of Waterford Regional Hospital, and I listened to all of the consultants who are very concerned about the review which is being carried out about hospital networks in the region and the possibility of the break-up of the clinical network in the South East, and of the potential of Waterford Regional Hospital being networked with Cork, and the fear that we could lose services, that the regional hospital will be downgraded as a consequence of that. That is a very real concern that they have. I know they've raised that with yourself. They've sent you their submission. This again is about making sure that we have proper health services for people, that geography is not an issue in terms of the kind of treatment that you get. But really, Minister, you need to do much better than this in terms of this bill if we are to deliver the kind of public health service that the citizens of this country need, and if we are to truly democratise the health services and make sure that patients and citizens get the treatment that they need, not on ability to pay, not on where they come from, but because it's a right, and that the state has a responsibility to vindicate that right and deliver the very best health services to the people of this state.